Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Take a moment and picture depression not only as sadness, but as a whole body state. The brain feels heavy, motivation becomes harder to reach, sleep changes, inflammation may rise, appetite shifts, and even the body's sense of energy can feel muted. Now ask, why would something as simple as krill oil, a marine omega-3 source, have anything to do with mood? How can a fat from a tiny ocean crustacean influence something as complex as depression? Begin with this principle. Do not think of krill oil as a standalone cure. Think of it as a biological support tool. Use it, if appropriate, as part of a wider plan that may include medical care, psychotherapy, sleep repair, movement, nutrition, social connection, and medication when needed. If depression includes suicidal thoughts, severe functional decline, psychosis, bipolar symptoms, or inability to care for oneself, act immediately. Contact a licensed clinician or emergency service. Do not try to solve that situation with supplements. But now look deeper. Depression is not only a chemical imbalance in the old simplified sense, it can involve inflammatory signaling, altered cell membranes, oxidative stress, impaired neurotransmission, disrupted stress hormone regulation, and reduced neuroplasticity. Omega-3 fatty acids, especially EPA and DHA, sit right at the intersection of those pathways. Krill oil matters because it provides EPA and DHA in a form partly bound to phospholipids, especially phosphatidylcholine, and it also contains astaxanthin, the red antioxidant pigment that gives krill oil its deep color. Reviews of marine omega-3 phospholipids describe how this phospholipid structure may influence absorption and tissue incorporation, which is one reason krill oil attracts attention beyond ordinary fish oil thinking. So ask yourself again, why would the brain care about the form of a fat? How could the packaging of EPA and DHA change the biological conversation? The answer begins with the brain's architecture. Your brain is not built only from electrical impulses and neurotransmitters. It is built from membranes, fat-rich, highly organized, constantly adapting membranes. If those membranes become less flexible, less well-supplied, or more inflammatory in their signaling, mood regulation may become harder. Therefore, when we discuss krill oil, do not imagine a stimulant. Imagine a quiet structural intervention, nourishing the membranes, moderating inflammatory tone, and giving the nervous system better raw materials. First, understand the two major omega-3 actors, EPA and DHA. DHA is deeply involved in neuronal membrane structure. It helps support membrane fluidity, receptor function, and synaptic behavior. EPA is often discussed more in relation to depression because clinical studies frequently show stronger mood signals with EPA-rich formulas than with DHA-heavy formulas. Why? One explanation is that EPA seems especially active in inflammatory regulation. It can compete with arachidonic acid pathways, shift eicosanoid production, and contribute to pro-resolving mediators, molecules that help the body end inflammatory responses instead of letting them simmer in the background. Reviews of omega-3 inflammatory biology describe EPA and DHA as precursors for resolvins, protectins, and related mediators that help regulate cytokines and inflammatory resolution. Now ask, how does inflammation connect to depression? Do not reduce depression to inflammation. That would be too narrow. But recognize this, many patients with depressive symptoms show signs of low-grade inflammatory activation. Inflammatory cytokines can influence serotonin metabolism, dopamine signaling, glutamate balance, sleep quality, fatigue, and the hypothalamic pituitary adrenal stress axis. This means the body can send distress signals upward into the brain. If inflammation is part of the pattern, then omega-3s may help by changing the biochemical environment in which mood circuits operate. Here is the practical message. Look for the EPA content, not just the front label. Many people buy a bottle that says krill oil 1000 milligrams and assume they are getting 1000 milligrams of active EPA and DHA. Do not make that mistake. Turn the bottle around, read the supplement facts panel, count the actual milligrams of EPA and DHA. Then ask, how much net EPA am I really getting? The International Society for Nutritional Psychiatry Research guideline for major depressive disorder emphasized EPA-dominant preparations, recommending either pure EPA or an EPA/DHA combination with an EPA to DHA ratio above 2:1, often targeting 1 to 2 grams of net EPA daily in clinical contexts. This is where krill oil becomes both interesting and limited. Krill oil may offer EPA and DHA in a phospholipid-bound form, and some bioavailability research suggests phospholipid omega-3s can incorporate well into plasma phospholipids. A comparative bioavailability study examined fish oil forms and krill oil, while broader reviews note that omega-3 bioavailability depends on chemical form: ethyl, ester, triglyceride, reesterified triglyceride, free fatty acid, or phospholipid. But be precise, most depression trials are not specifically krill oil trials. Most of the mood evidence comes from EPA/DHA supplementation in general, often fish oil derived or purified EPA formulas. So say this carefully. Krill oil may be a useful omega-3 delivery option, but the antidepressant evidence belongs mainly to EPA-rich omega-3 therapy, not uniquely to krill oil. Why does that distinction matter? Because it protects us from marketing language. It keeps the conversation medical. It tells us what to do next. Choose based on active dose, purity, tolerability, and clinical fit. If a krill oil product contains only a small amount of EPA per capsule, it may require many capsules to approach the EPA levels studied for mood. That may increase cost and inconvenience. So do not chase the ocean story, chase the numbers. Ask, how many milligrams of EPA? How many milligrams of DHA? What is the ratio? Is it third-party tested? Is it fresh, protected from oxidation, and taken with food? Now let us examine effectiveness. Meta-analyses of omega-3 supplementation for depressive symptoms have reported mixed but meaningful signals, especially when EPA is prominent and when omega-3 is used as an adjunct rather than a replacement. One systematic review and meta-analysis found evidence supporting omega-3 supplementation in depressive disorders, while also showing that study design, population, dose, and formula matter greatly. A major long-term prevention trial in adults without depression at baseline found that marine omega-3 supplementation did not prevent depression or clinically relevant depressive symptoms over years of follow-up, which tells us something important. Omega-3 is not a magic shield for everyone. Meanwhile, the National Center for Complementary and Integrative Health states that although some studies are promising, whether omega-3 supplements are helpful for depression remains uncertain overall. So what should you conclude? Use discernment. Omega-3s may be more meaningful for certain people, those with low fish intake, low omega-3 index, inflammatory features, metabolic stress, postpartum vulnerability, or persistent symptoms despite standard care. Ask, is this person omega-3 depleted? Is inflammation part of their picture? Are they already receiving evidence-based depression treatment? Are they using an EPA-forward formula? These questions matter more than simply asking, does krill oil help depression? Now let us go into the how more deeply. First, membrane support. Neurons communicate through membranes. Receptors sit in membranes. Transporters sit in membranes. Ion channels sit in membranes. DHA helps maintain membrane fluidity, and EPA influences membrane-derived signaling. When omega-3 intake is low and omega-6 intake is high, the inflammatory tone of membrane signaling may shift. Therefore, tell the body, replace some inflammatory pressure with pro-resolving material. That is one of the most biologically plausible ways omega-3s may support mood. Second, inflammatory resolution. Do not think only in terms of blocking inflammation. That is too crude. The body must also resolve inflammation. EPA and DHA can be converted into specialized mediators such as resolvins and protectins, which help the immune system calm down after activation. Ask, what if part of depression is not only stress, but stress that cannot fully switch off? In that case, omega-3s may help by giving the body ingredients for the off-ramp. Third, neurotransmitter environment. Serotonin and dopamine do not act in isolation. They operate within membranes, immune signals, hormones, and metabolic conditions. Omega-3s may influence neurotransmission indirectly by improving membrane behavior and reducing inflammatory interference. So do not expect krill oil to feel like caffeine. Tell your audience, expect support, not a jolt. Expect gradual change, not instant emotional rescue. Fourth, oxidative stress and astaxanthin. Krill oil naturally contains astaxanthin, a carotenoid antioxidant. This does not mean krill oil is automatically superior for depression, but it adds another layer. The oil carries not only EPA and DHA, but also a pigment associated with antioxidant activity. Reviews of krill oil composition describe astaxanthin as one of its minor components, alongside phospholipid-bound omega-3s. Ask, why does the capsule look red? What is that color doing there? The color is not decoration, it reflects a compound that helps protect the oil and may contribute to broader biological effects. Now make it practical. If someone is considering krill oil for mood support, give them these commands. First, speak with a healthcare professional, especially if they take anticoagulants, antiplatelet drugs, blood pressure medication, psychiatric medication, or have surgery planned. Also do this if they are pregnant, nursing, have bipolar disorder, or have a fish or shellfish allergy. NCCIH specifically advises extra caution for people who are pregnant or nursing, taking medicines that affect blood clotting, allergic to fish or shellfish, or considering omega-3s for a child. Second, check the label for EPA and DHA. Do not stop at krill oil 500 mg or krill oil 1000 mg. Ask, how much EPA? How much DHA? What is the EPA to DHA ratio? Third, take it with a meal containing fat. Why? Because fat-soluble nutrients tend to absorb better with food, and taking it with meals may reduce fishy burps or stomach upset. Fourth, give it time. In mood studies, changes are usually assessed over weeks, not days. Think in terms of 8 to 12 weeks while tracking symptoms. Use a simple scale: mood, sleep, energy, concentration, irritability, and anxiety. Do not trust memory alone. Measure. Fifth, protect the oil. Store it as directed. Avoid rancid smelling capsules. If it smells sharply spoiled, do not use it. Oxidized oils are not what you want when the goal is nervous system support. Sixth, combine it with foundations. Tell people, walk daily if you can, protect sleep, eat protein at breakfast, reduce alcohol, seek morning light, and stay connected to people who stabilize you. Why? Because omega-3s work inside a living system. They are not meant to carry the whole burden. Now address expectations directly. Some people may feel a small but meaningful lift, less irritability, steadier energy, fewer inflammatory aches, better emotional recovery after stress. Others may feel nothing. Some may have gastrointestinal discomfort, skin reactions, or interactions that make it unsuitable. The evidence does not support saying everyone with depression should take krill oil. The evidence supports a more intelligent statement. EPA-rich omega-3 support may benefit some people with depressive symptoms, especially as an adjunct, and krill oil is one possible source when its active EPA/DHA dose, safety profile, and tolerability make sense. Also, be honest about disagreement in guidelines. The Nutritional Psychiatry Guideline gives a favorable role to EPA-dominant omega-3s in major depressive disorder when properly assessed and monitored. Yet the 2026 VA/DoD Clinical Practice Guideline suggests against omega-3 fatty acids for treatment of major depressive disorder, while noting EPA may have a small symptom benefit. Why does this happen? Because clinical evidence is not always clean. Depression has many subtypes. Trials use different doses, different formulas, different durations, different populations, and different background treatments. So command your thinking. Do not ask for one universal answer. Ask who, what dose, what ratio, what baseline status, what diagnosis, and what outcome. So bring the whole idea together. Krill oil may help depression, not because it makes you happy, but because it may support the biological terrain in which mood is built. It supplies EPA and DHA, often in phospholipid form. It may help membrane function. It may help inflammatory resolution. It may offer antioxidant support through astaxanthin. And when the EPA dose is meaningful, omega-3 therapy has a body of evidence suggesting possible benefit for depressive symptoms in selected people. But keep the message responsible. Do not replace professional treatment. Do not ignore severe symptoms. Do not buy based on marketing. Read the label. Count EPA. Monitor response. Use it with food. Give it weeks. Combine it with sleep, movement, therapy, medical care, and human connection. Ask one final question. How should we treat depression if the brain is not separate from the body? Treat it with respect for the whole system. Support the mind, support the membranes, support the immune balance, support the daily rhythms, and support the person. That is the real value of krill oil omega-3 in this conversation. Not as a miracle, but as a carefully chosen support that may help the body become a better place for recovery to happen. Take care of yourselves, take care of each other, and stay close as a community. I'll see you in the next topic.